Hello, how's everybody doing today? So in today's video, I'm going to do a recap of my first semester of nurse practitioner school. I'm going to talk about what grades I got and just kind of go over how the semester went overall. Just kind of, recap the whole semester. And then I'm going to look forward to my second semester. We're going to look at what books I got for next semester and just tell you what classes I have coming up. So anyway, the first semester just ended, and I'm glad it's over, but at the same time, I actually really enjoyed it a lot. I had advanced pathophysiology, and then I had a research class or a research methods class. And honestly, I liked both of them, but when you think of nurse practitioner, for me personally, I think of the advanced patho, right? So I really enjoyed it. I've had some days off since the semester ended and before the next one starts in about a week. And I've been going over all my patho, just different lectures, different apps that I've been using. I'm still doing flashcards, still going over it because there was so much information. It was insane. Like I could probably study I could probably for the next 3 weeks study every day for 8 to 10 hours and still not cover everything in patho, or at least maybe I'd cover 50%, 75%, if even that. I can't even say 75. I'm kidding. It'd probably be 25 to 50%. But anyway, so I got it. I'm done with that, and then research methods. Wasn't hard overall. I enjoy learning about the research process, how research is conducted, a little bit of the statistics involved with the different p-values and different things like that. So that was cool, learning that. But I did struggle with that one in comparison because I didn't spend as much time on it because I really wanted to get down the patho because everybody's like, you need to know that. You need to have that down cold because that's going to be the basis for everything you do. So anyway, so with that said, I finished the semester with, in pathophysiology, I got an A. And in my research methods class, I was a little disappointed. I ended up getting a B in that class. I missed it by like 4 points. And it really all came down to, the crazy thing was, and the way the grades are, is it really came down to the last final paper. It was like a 12, 14 page paper, whatever it was. Man, part of me was kind of rushing through just to get it in at the last minute, but then part of me was like, I really need to focus on this and I really need to do well because that last paper is what really determined if I got an A, got a B, or even if I got less than a B, which means I would have to repeat the class, because it was such a huge chunk of my grade, and I didn't realize that. I didn't factor that in throughout the semester. So next semester, I'm going to have to make sure I really pay attention to my grades and like the percentages, of each assignment. And if an assignment's a huge percentage, I need to spend a lot more time there. But anyway. Lesson learned. Got to be, like I said, in that class, pathophysiology. That's the one I want to make sure I got an A in. And luckily I did. But anyway, so fast forward to the second semester. I still cannot believe that I got the first semester done. I think I just counted it the other day. I think I have 7 or 8 semesters left. Too many to really be counting right now anyway, but whatever, one down, however many to go, 7 or 8. So anyway, next semester's coming up. Got my books in the mail. Always an exciting time. I know some people are like, why are you showing your books? I don't know. Some people ask, believe it or not, what type of books you use, that sort of thing. Are the books, I had a couple people asking about patho. They were asking, is the book that you use in your graduate school, is it similar to what you use in your undergrad? And it's not. It's a lot more detailed, a lot thicker. If you watch my other video where I break down those books, I mean, the book is ginormous. And anyway, so for this semester coming up, I have theory in nursing, which I'm not excited about. I'm not a theory person. Look, I'm like, how many times in different programs can you talk about Florence Nightingale or some of the other ones? I think it's important, but did that in LPN school. Did that for my BSN, which coming up, I think I'm going to do a video on how I went from LPN to my graduate school. But that'll be a future video. But anyway, so, you go over all this theory and stuff, and it's like, I've done all that. I'm like, so I'm hoping it'll be a little bit different. Maybe there'll be some different type theories or whatever. But the 2 books, so I got 2 books for that class. Gotta stay positive. This is what I wanted to do. But, the first one is this one. It's a theoretical basis for nursing. Pretty good sized book. This one's roughly 500 pages. And it's similar to, it reminds me of one of my research methods books, the way it's laid out and everything. So I honestly, I couldn't even tell you. I haven't really even looked through this book yet to know what's in it. But keep you guys updated on that one. And then for the same theory class, this one is called Family Health Care Nursing. About the same. Well, it's a little bit bigger because the pages are bigger. I honestly, I don't even have a clue what's in here. I think there's a lot about like family needs in the intensive care unit. I guess just needs of family-based needs, I guess, environmental trauma. So, this may be interesting. I'll try to be open-minded. It looks like we're going to be talking a lot about family management, family health model, what are some other things, family adaptation. It's all centered around families and I guess how they adapt to trauma, how they adapt to possibly even, touching on abuse and things like that. So, I definitely think it'll be important. It talks about family caregiving. Sometimes caregiver burden, that's a real thing that you see. People have to take care of a loved one that's real, sick, and they're young, and they have, a lot of things going on personally in their life. They maybe have young kids, and you've got to take care of an older adult who's bedbound or whatever. So I'm going to try to stay positive, open mind. I'm just not a theory guy. I'd rather, you see a lot of people that talk about nurse practitioner programs, and one of the big, negatives that people say are there's a lot of theory, a lot of fluff, as they call it, and I'd rather take a class on like MRIs or CT scans or like an ultrasound class or some kind of scan, X-ray class, which I know we're going to go over that, and that's interwoven throughout the curriculum, but still, I'd rather have a dedicated class kind of for that if I could. But anyway, so that's the first one. Now, here's the second class coming up. I'm really excited about this class, and this is my advanced pharmacology class. So this one's kind of, scary in a sense, in a way, because, it dawned on me when I was looking at some like the syllabus that's coming up. There's a section on, you start off with how to write a prescription. And I'm like, holy crap, like this is going to be the first class where I learn how to write an actual prescription, like as a provider. As a nurse, you write orders all the time as a nurse. A lot of times we talk to the doctor, obviously, but you do, but sometimes they're like more standing orders. You're writing orders out, and you call the doctor or fax them over to him. He just signs them and sends them back. So in a sense, it's you have an idea of how to write them, how it's done, but you don't. Now it's like I'm making the decision. There's nobody. Well, there are collaborative states, and we'll get into that later on with an MD and a nurse practitioner, but for the most part, as a provider, you are writing the prescription. And anyway, so the first book, really cool. I was really looking forward to this little pocket-sized book that can go in like a lab coat or something. And this one's called The Sanford Guide to Antimicrobial Therapy. This book's been around a long time. I've heard of it. I've seen it around, different places I've worked. This edition just came out, and the cool thing is they sent an extra little card with, guess what? Coronavirus. Because I think this book was just released at the beginning of April or March, end of March, beginning of April, probably end of March. Because I just got it in the mail. I was going to actually get the other edition, the older edition. So basically this book is nothing but antibiotics. It also has antivirals, for HIV, for just any kind of viral or virus therapy, or antibiotics, if you have an infection. But the crazy thing about this book, so when it's small, right? So you think, okay. But the crazy thing is the writing. I don't know if you can see that in the video, but the writing is tiny in this book. Like, I'm going to be in here like looking like an old man with this book or something. And my up-close vision, I have good up-close vision. But yeah, the writing's very small, but apparently this one's going to be carried around with me a lot through the whole program. I'll have this like in a lab coat or whatever, or my scrubs or whatever. It's a very important book. Can't wait to use it though. And then the other one is just a regular, another huge book, kind of like my patho book, a little bit smaller possibly, I don't know. And this one is called Pharmacotherapeutics for Advanced Practice. So yeah, it's a big book, over 1,000 pages, boy. But so far I was so excited. I went ahead and read like the first overachiever, but read the first 2 chapters just about now. They're kind of shorter chapters, about 13 pages each or something like that. But it's not too bad, not too dense of reading. So anyway, I think I'm going to really enjoy this class. And I'm just excited. I'm excited for semester 2. I'm going to try to shoot for 2 A's this time around, be an overachiever and all that good stuff. But anyway, if you've taken these classes before, if you've taken advanced pharmacology and the theory class, all my friends that are nurse practitioners, or that maybe are in a nurse practitioner program and they're a little further ahead of me, tell me, send me a comment and let me know some study resources you used for the class, and if there's any cool websites or quiz sites that you went to, let me know, and I'll see y'all in the next video. Have a great one.